Hi, I'm Dr. Jack West, medical oncologist and thoracic specialist at Swedish Cancer Institute in Seattle, Washington. I'm also the founder and president of GRACE, Global Resource for Advancing Cancer Education. One of the key concepts in management of patients with metastatic or advanced stage 4 lung cancer is the idea of giving a maintenance therapy. And this really means that typically when we're talking about chemotherapy in particular, we often start with a 2 chemo drug combination, sometimes with another drug added to it. But then after 4 to 6 cycles of that combination, which can have some cumulative side effects, we tend to drop one of the agents called cisplatin or carboplatin. So this is what we typically call a platinum doublet. After 4 to 6 cycles, you seem to reach a point of diminishing returns where you're more likely to have incremental side effects than incremental benefits beyond those 4 or 6 cycles. And yet, continuing some form of active treatment against the cancer can slow the time before the cancer progresses and actually has been shown to improve survival. And this has been shown particularly with the agent Alimta or pemetrexed, given in combination with platinum, initially as a doublet and then stopped, and then just continuing the platinum component, but stopping the doublet with the platinum. And so the issue is, how do you approach talking with and deciding what best to do with a patient as you think about maintenance therapy? I would say it's important to recognize that giving a maintenance therapy, kind of downshifting your treatment after a few months, is one option, and I think it's a strong one, but it's not an absolute mandate for every patient. It is reasonable to consider taking a break for some patients and holding off on treatment. You can consider going back and resuming it. Other patients may feel very vulnerable off of treatment and want to stay on it. What I tend to do when considering the timing of the discussion is really try to explain to patients right from the beginning that we're going to plan to treat for up to 4 to 6 3-week cycles of a 2-drug combination. And then as we go along, we'll see how their cancer is responding, and we'll see how they are doing and how they're feeling. And we can consider going on to 6 cycles if patients are tolerating it well and their cancer is responding. We can very easily stop after 4 cycles, drop the platinum, and continue just with the Alimta. And otherwise, they will have some say, and even if they want or need a break, that's perfectly reasonable to consider. So for me, when considering the timing of the approach to maintenance therapy, I don't just tell them about it for the first time as they get to 4 or 6 cycles. I actually talk about it with them 1 or 2 cycles several weeks before that, so they can start to really think about the options of how they are tolerating treatment, how do they feel about continuing on therapy and maintaining some activity against the cancer, or do they really just want time off from their treatment altogether? These are all options to consider, but I think it's important to have good discussions that include the patient's input about their preferences as you develop a plan together about the best maintenance therapy approach.